I'm Sabrina Samuels, and welcome to my show, Upfront and Personal. It's my intention to deliver information that will help us maintain a quality lifestyle in all aspects of our lives. So let's get started. Welcome back to another edition of the Sabrina Samuels Show with me, Sabrina Samuels. On this edition, we'll get upfront and personal as it relates to a woman's anatomy. So stay with us. We'll be right back. Welcome to the Beckman Method. I'm Sabrina Samuels, and enhancing the lives of others have been my passion for over 35 years. Through interactive workshops and seminars, inspirational and motivational speaking, I help others to discover the hidden treasures, gifts, and talents within themselves. Take a look at our website and review our menu selection. Thank you. Welcome back. Once again, I'm Sabrina Samuels, and joining me on the phone is Dr. Denard Fobbs from Fresno, California. Dr. Fobbs, welcome to my show, sir.
Good morning, Sabrina, and thank you.
All
Good
right.
to be here.
Thank you. Dr. Fobbs, there's so many women out here going through changes as it relates to hormone imbalance. People are not knowing what to do. Women are going to doctors being prescribed certain medications, and they're just lost. Can you talk to us about what is happening with natural hormone replacement therapy and what is going on with the replacement therapy that women are getting nowadays? And I don't want to discredit any doctors out there, but the side effects, etc., please.
Well, I'm happy to speak to that, Sabrina. The main thing I believe that is the problem today is that we were given information about 12 years ago from the Women's Health Initiative study, which misled a lot of people. It was an excellent study in terms of the data and the information provided. It showed us without a doubt that the hormones we've been using for 40 years, Primin and Provera, which is very unnatural and synthetic hormones, are absolutely dangerous.
Wow.
So that when women have fears and in conversation that hormones may be dangerous, they are in part absolutely correct, because synthetic hormones and hormones from animals that were not derived and do not contain natural human substances are dangerous. What they need to know is that there are natural alternatives to that are exactly the same as the hormones that their bodies have had and continue to have for their entire lives.
Well, Dr. Fobbs, talk to us about natural hormone replacement therapy. And ladies and gentlemen out there, I want you to know that I did go to Dr. Fobbs for this treatment, and it has been great. I was on the natural hormone replacement therapy for about 2 years, and now I have no more hot flashes, no more mood swings, none of the unfortunate, uncomfortable situations that plague women. Talk to us, please.
Well, yes, we do a very simple and I think elegantly simple thing in terms of managing hormones, Sabrina. We use exactly the hormones that your body already has. The hormones we use are derived from natural plant sources, wild yams, soybeans, and they are converted into the exact same hormones that your body has had your entire life. So we use these as a cream, so they're absorbed through the skin, and you don't have any gastrointestinal or other metabolic influences that causes the hormones to be unnaturally treated or metabolized by the body. So you end up with a hormone environment that is exactly the way it was intended to be. It duplicates the body's natural hormone substances. It duplicates the exact balance of a healthy, 25 or 30-year-old with perfect hormones.
Absolutely. Now, let me ask you this, cut in there. How would a person out of state contact you, get in touch with you, and actually do the testing? Because I know how I did it, but for people who are interested in this natural hormone replacement therapy, what would they do, sir?
Well, your experience, Sabrina, is a good model, because what we try to do, because there is such a deficiency in access to these types of natural hormones and to the understanding and the process of balancing hormones, that we have put contact information on the website, which is just drfobbs.com. ovulation, etc. We can mail hormone testing packages that you can do at home to anybody, any place in the country. We can work with their primary care OB/GYN doctors to coordinate compounding pharmacies and prescriptions for natural hormone cream anywhere in the country. So, we're happy to consult and to work with them and their doctors anywhere to make these improvements happen.
Okay, good. And ladies out there, all you have to do is follow the directions on the kit and send it back into Dr. Fobbs' office. And I believe you all send it to a laboratory for testing so that you can get an accurate accounting of what the balance of the hormones are now and what they should be. Is that correct?
That's exactly correct. We have entirely exploded the conventional way of doing hormone, Sabrina. We don't give anybody just random hormone doses, which can be dangerous. One of the reasons our hormones are so safe is that we measure the exact levels of hormones. We know exactly what are the safest levels of each and every female hormone in the body, and we match those levels precisely. And that's why we talk about precision hormone balances. We match the natural, most desirable levels precisely and exactly, so that we can claim, because of the fact we do such a precise job, that we can provide all the relief and all the access to the benefits of hormones and eliminate all of the risks.
Okay. What does this help? We're almost out of time. Boy, I can't wait until my show goes national and I have an opportunity to fly you in and have one whole hour to talk to you, because you're so informative. But what I would like to do is have a 3-part series with you. So let's continue with this one, but I want to talk to you a little bit more about the creams that you put in the vagina area and what those creams are for. But very quickly, tell us what your natural hormone replacement therapy can help a woman achieve in terms of how she feels. What will she expect to achieve when using your cream, please?
Well, let me give you the top hitters in terms of what natural hormone restoration and balance can do for a menopausal woman, Sabrina.
Okay.
You already mentioned vaginal health, because vaginal dryness and thinning of the vaginal tissues happen with menopause because of estrogen deficiency, so that is restored. The most common thing that brings women to the office and to our attention, as you know, are hot flashes, night sweats, brain fog, and this type of thing, and it gets rid of that because it restores the hormone balance that's missing.
Yes.
And I think that in the same vein, very important things that it does that most people, including many doctors, don't understand is when properly done, it reduces. There are great studies in Europe that show this, where they've been using natural hormones for 30, 40 years, that it can reduce the breast cancer risk by 10 to 30%, and it can, just as excitingly, it can reduce the heart attack and stroke risk by 40 and 50%, which is exactly the opposite of synthetic hormones, which make all these things worse.
Oh my goodness. Wow. Dr. Fobbs, you are a wealth of knowledge. I appreciate you coming on, sir. So I want to thank you for being a guest on our show. We're going to flash that website and your phone number at the end of the program. Thank you, sir, very much.
You're very welcome, Sabrina. I enjoy talking to you and be happy to talk back with you again.
Okay, we'll give you a ring next week, and I thank you so much, sir. More to come in a moment. Stay with us.
You're welcome. Bye-bye now.